So almost everything, almost not everything, but almost everything is connected to nutritional deficiency. We talked about selenium yesterday, right?
Yep.
And it makes the glutathione recyclable. Protein, so important, extremely important. Why is it important? Because all the neurotransmitters in our brain are made from amino acids, and all amino acids come from protein. I tell you, this is really true. Because when they consume a protein shake in my office, when they come in like suicidal with a plan, most doctors immediately call the hospital and admit them in the hospital. Well, I'll have them have a seat and give out premium protein shake or something like that, 30 grams of protein. Within 20 minutes, they forget they were suicidal. 25 minutes, they start smiling. 30 minutes, they're the ones cracking the jokes. And I'm like, wait a minute, nobody taught me this. They told me it takes like 7 days to recover from depression and all this. And I'm watching people in front of my eyes. I'm seeing them go from severely suicidal with a plan to cracking jokes in 30 minutes. So it's kind of difficult for me to ignore that, yeah, when it happens over and over and over.
Welcome back to another episode of Cultivating Change, everyone. I'm your host, Alex Corey. Today's episode is a big one. This is mental health. I've struggled with mental health since I was a freshman in college when I first got my taste of clinical depression, and that started me on my health journey. Today's guest, who's Dr. Shams, is a personalized precision psychiatrist. He's done thousands, probably 10,000 different genetic tests. So we're going over, if you have a child or yourself, any depression, anxiety, autism spectrum, Aspergers, ADHD, focus disorders, or anything that you would consider mental health. We're going to touch on fundamental nutrition, giving ourselves the building blocks of neurotransmitters, what that means, and what he's found for large sweeping patterns that actually affect real change in his decades as a psychiatrist. And just to be clear, nothing in this video that's coming up is to be taken as prescription or treatment advice or anything like that. Always check with your healthcare practitioner. Thanks for joining me today, Dr. Shams.
Thank you for having me, Alex.
Oh, it's my pleasure. I wanted to talk about mental health. We spoke recently, we met recently, and I was just fascinated essentially with the level of testing and, genetic testing and your breadth of work for mental health, because it's a huge topic nowadays. Like everyone's mental health, mine included, suffers from time to time, but your level of knowledge in the interplay of the genetic testing with all these gene mutations that we hear about online, but the actual, boots on the ground. It's one thing to like look at research papers and that you've had actual, 10,000 or however many clients. So I'm fascinated and want to get into what you found with moving mental health that actually has worked for people. Could you give a brief introduction of just yourself and the work you do?
Yes, so my name is Dr. Shams Pepermintwala. I'm a child and adolescent and adult psychiatrist practicing in Midland, Texas. I got my training, my internship was in Buffalo, New York, SUNY Buffalo, and then the rest of it was all at UT Southwestern in Dallas. I've been practicing in Midland for about a little over 13 years. And over the years, what I've learned is I've actually found myself looking for reasons to fix people, to cure people, which is something that is unheard of. Like nobody talks about curing anybody anymore. Everybody is focused on treating people because that's where the most money is, For whatever reason, I thought I should try to cure my patients. And in thinking about it, the way I looked at it is, if God made diseases, he also made cures, So I just have to look in the right place and find it. Just because somebody else didn't find it doesn't mean that I'm not going to find it. So I've been looking for it, and I found some options in supplements, in minerals, certain vitamins, just nutrients like protein. So important, extremely important. Why is it important? Because all the neurotransmitters in our brain are made from amino acids, and all amino acids come from protein. So the digestion of protein is very, very important. The problem in this country is that children are trained, I'm sure it's not intentional, but they are trained to not be able to differentiate hunger and thirst. Because right from the time they're in preschool, they are given one break where they are supposed to quench their thirst, use the restroom, and eat lunch, all of it within a short period of time. Sometimes it's 30 minutes, sometimes 45 minutes, but it's a ridiculously short amount of time. Now, ideally, if you want to digest the protein properly, what you need to do is drink a decent amount of water. In adults, it's like 16 ounces, 45 minutes before the meal. Chew your food really well. The reason for that is because you're fully hydrated. By the time it's time for you to have lunch, you're fully hydrated, so you don't overeat. Because most of the people that are overeating are doing so because they're not well hydrated, and they are mistaking their thirst as hunger, and that's why they're overeating. Now, most people don't know this. The other reason why people overeat is because it takes about 20 minutes for your brain to get the message that you have eaten. So it's super important to chew the food really well. Make sure the salivation and the mastication occurs properly. So you don't need to be sipping some drink to swallow your food. Your saliva should be more than enough, because digestion starts in your mouth, with the enzymes in the saliva, and then goes down. Now, when you drink water, that sort of dilutes your, the acid in your stomach. And the acid is very important to activate the protein digesting enzymes. And the problem we have is like most people are not chewing their food well. And I keep telling my patients, you don't have teeth in your stomach. So the only time you can chew it is when you put it in your mouth. You can't be, you can't expect your stomach to do the chewing. It's not going to happen. And then drinking the water messes up the digestion. So it doesn't mess up the digestion of fats and carbs. So those two, they don't care if you drink water. But the protein is super important to make sure that gets digested right. So I have so many patients that eat lots of protein, but it's not really getting digested and absorbed, in my estimation. Now, I don't know 100% if it is getting, because if it was getting digested well, then they probably would have adequate amounts of neurotransmitters and they wouldn't be in my office in the first place.
Yeah, what brings people into your office predominantly?
Oh,
everything.
It's symptoms. It's all sorts of stuff. Like usually they'll come in with anxiety or depression. Quite a few of them will come in with ADHD. Occasionally I'll have somebody who has bipolar. Sometimes I'll get schizophrenia or psychosis. A lot of kids come in with Aspergers or autism. They also have separation anxiety disorder, because the parents haven't learned to set limits with the kid. So the kid has gotten too attached to the parents and sleeping in bed with the parents, creating a problem for themselves and the parents. Because my question to them is like, okay, when are you going to kick him out of your bed? I mean, when he turns 18? I mean, what's your plan? Do you have a plan? Do you think it's normal? So that kid has difficulty doing sleepovers. That kid has difficulty. And when these kids go to college, they usually drop out in the first semester and come back home because they can't handle the separation anxiety because they've never been prepared for that. It's amazing. Right. Like to have kids, you don't need a license.
Yeah, there's no test.
I wish is required a license, so that we could train people and give them some training in raising kids and doing some parenting skills and just basic nutrition, basic stuff, And it's not happening, and I don't know what to do about that. What can I say? It's just something that most people, when they have kids, they don't really think about all this, though we should. Like we do sometimes premarital counseling, in certain places they have that where it's required, to get married in a certain church. They require you to do like 6 sessions of premarital counseling or something like that. I know this because in my first marriage, I had to do that with my ex-wife. It didn't work though, but that's okay. It's something that had to be done so that we could proceed with our plans, Yeah. But I wish there was something like that set up, or at least in the sex ed classes that they do in high school and stuff, they should be more focused on understanding the way the opposite sex thinks, to start off with, because it's amazing how different girl children are, boy children. They're so socially aware. I mean, they make eye contact with everybody in the room. And the boys, they don't make much eye contact. They're more interested in playing with things and toys, So the difference is totally real. I mean, from the time they're born, you can tell the difference.
Yeah.
Girls are a lot easier to raise when they're younger. They become most difficult when they become teenagers. You may think boy teenagers are hard. No, girl teenagers are the hardest. It's so challenging. I mean, because they have that skill, they know how to argue. And they see that women, when they listen to somebody talking, they listen with both sides of their brain. So we don't have a chance. I mean, trying to argue with them is you're wasting your time.
Yeah, I've noticed.
Just apologize and move on, nothing's going to come out of it because she's using both sides of the brain and we are just using the left side. It's the logical side.
So I want to go back to, he listed a whole bunch of things. So he said anxiety, depression, ADHD, Asperger's, autism. I'm guessing are psychiatrists the first line of defense? So do people come to you first, or do they usually come after like a general physician just goes, hey, try something else?
See, if you're in a bigger city, then you have developmental pediatricians. Yeah. Those are the ones that people go to first because they notice that there's something developmentally wrong. The child is not speaking right, or the child is not, turning over or walking when he's supposed to. They go to a developmental pediatrician. Now in Midland, we've had them off and on, but they all tend to move out. So when there is a developmental pediatrician available, those are the ones that see the kids. Occasionally a child neurologist may be seeing them, but again, it depends on how big a city it is. Yeah. Most people go to like children's hospitals or Scott and White, those type of hospitals that are very, very good with taking care of children. And they have all sorts of pediatric specialties over there. And psychiatrists, for whatever reason, there's a huge stigma with that. So we tend to be the last ones. Not always. Sometimes, the parents are educated or if they're physicians or something like that, they may come to a child psychiatrist straight away. But it's just interesting. They come to us from so many different places. Like a pediatrician may refer them, a family practice doctor may refer them, So anyway, it's the best part is that every patient is different.
Right.
Like this is what I didn't like about medicine was every patient is the same. It's like you're treating a viral infection or you're treating strep throat. It's like, it doesn't matter. The story of the patient doesn't matter. Because the infection, you can see it, it's exactly the same. Or maybe slightly different presentation, but you're using the same antibiotics and, it's like you don't use your brain much. Sorry, I don't mean to offend any of my colleagues, but to me, it felt like I was just, anybody can do that job, it would seem, because there's all these...
one symptom, one fix. A pill for every ill, so to speak. So they're matching symptoms to fixes. It's not really the holistic presentation of the person.
Yeah, I think you're right. The prevention part, there's very little that is focused. The prevention, most people don't focus on that. We don't really have that specialty here. Where I grew up, I went to medical school in India, in Bombay, and we used to have a specialty called preventive and social medicine. And some of my classmates, they specialize in that, and those are the people that take care of the community health clinics, Now, here we do have the Masters in Public Health, which is slightly different. And those are the doctors that can be utilized for community clinics. It's just different. It depends on how they use it. But you can be an MPH without being a doctor also. Right. Whereas my preventive and social medicine is specifically medicine and it's all doctors. And sometimes I wish we could do that in this country because eventually, if you don't do prevention, people are going to eventually end up on Medicaid. after
What
the
is the
election,
prevention, as you've seen?
like
What
for
are the
example, like
protocols?
let's say smoking, right? So smoking, nothing will happen for a few years, and then when you finally do get the emphysema or the lung cancer, you're going to end up losing everything you have because you can't pay your bills because you're sick, and eventually you end up on disability or you end up on Medicaid, and it's like eventually it comes on to the government has to pay for the person anyway. So why not do some prevention instead of we count healthcare in the GDP of the country, right?
Right.
So the government always wants to get a higher GDP. So there's a bit of a conflict there. It's like how can somebody whose entire goal is to improve the GDP of the country focus on reducing healthcare costs, and that will reduce the GDP kind of. So it's a little conundrum, I guess. I don't know. I've never been in those shoes, of a politician, but
So healthcare should be a business model.
it is a business model. The only problem is it's a sick care model. It's not a healthcare model.
Right.
In the sick care, everybody makes money
Symptom
and people get
management.
sick. So the motivation, the unconscious financial motivation in healthcare is all about you only get paid when people get sick. So, doing blood tests, for example, when I see a patient, I do a routine yearly blood test, I check their insulin level. Now, why do I check the insulin level along with the hemoglobin A1C? Because I want to figure out if they have insulin resistance. Because once your hemoglobin A1C gets higher than a certain amount, like go above 5.6, 5.7, you're already pre-diabetic. It's just a matter of time before you become diabetic. So it's very difficult to reverse it once your hemoglobin A1C gets out of control. But when you're developing insulin resistance because you're consuming too many refined carbohydrates, we can work on trying to get that down. See, one of the things about insulin, it's one of the, as far as I know, it's the only hormone that creates fat cells in our body. Now, because what does insulin do? The job of insulin is to make sure that sugar gets stored in the body somewhere. It tries to force it into your cells, but your cells resist it because they have enough calories, they don't want anymore. That's what's insulin resistance. So the person is consuming more calories than they need. And that's when the insulin resistance occurs. And then eventually, the insulin has to create fat cells so that they can store all those calories in those fat cells. I wish people knew that. Because
just the basics of hormones and how blood sugar works.
Yes. And then, like how fat is created. How many people know that fat is created by insulin? I mean, if you knew that, then you will make sure you don't raise your insulin by consuming carbs. It's just logical, right? Once you understood that, but that fact has not been marketed or people are not aware of it. So now those who are in the weight loss industry, they understand that. So they will tell you to not eat carbs, but they don't explain why don't eat carbs. Because if you eat carbs, you have insulin levels will go up, and the higher your insulin level goes, the more fat your body is going to create. You want to get rid of the fat. So you want to keep your insulin level as low as possible so that you can get rid of fat. Burn off the calories, get rid of fat. I know this is not what we talked about yesterday. But
no, that's fine. We can go anywhere you want. And have you found a link to blood sugar levels, insulin levels, to any of the mental health issues that you listed that you see?
Yes.
To ADHD, to anxiety, depression, any of that?
Oh, yes. So what I've noticed is, now this is very straightforward. Whenever blood sugar levels drop, which happens frequently with people who consume refined carbs, because refined carbs make you spike your blood sugar, which causes your insulin to spike. And then the spike in insulin brings down your blood sugar too quickly. So it goes past that point where it becomes an issue. So once it goes past a certain point, then it starts causing hypoglycemia. And then your body has a way to deal with hypoglycemia by producing adrenaline. That adrenaline raises your blood sugar, but there are people who cannot metabolize adrenaline properly because of mutations. And that's where the genetic testing comes in. So when we do the genetic testing, we can tell, okay, if this person has normal COMT, or if they have one COMT mutation or two COMT mutations. Now, the ones that I've seen have the worst anxiety are women who have two COMT mutations, because the estrogen already slows down the metabolism of adrenaline anyway. And then the COMT mutations definitely interferes with the COMT enzyme, which deactivates adrenaline. And that enzyme, if that's not working right, I try to give people an example. Like, if a guy has got like one broken foot, he can hobble and somehow get it. But if both feet are broken, it's really hard to get anywhere. And then on top of that, if he's carrying a load, like you got estrogen on top, that is slowing you down. That's why women have more anxiety, because they don't metabolize adrenaline as fast as we do. But then in the Western world, there's all this caffeine addiction, which that's the fourth one. Like, so the worst anxiety patient is, the patient with the worst type of anxiety is a female who drinks caffeine and has two anxiety, like the COMT mutations. That poor lady has no chance. I mean, she's going to be anxious 24/7. Even in the dreams, even these people, when they dream about anxiety-provoking situations where they're having anxiety attacks. So they're getting stressed out and they're checking on people to make sure everybody's okay. It's like the entire theme of their life, 24 hours a day, is fear. Fear is what, but that fear is not real. It's excessive adrenaline causing the fear. But they don't want to feel like they're crazy. So what they do is every day when they feel fear, they just review everybody that they care about, and they start calling them. Are you okay? Just checking on them. I mean, if you care about 10 people, surely one of them is having some problem. So then they feel like, okay, I'm not crazy. I'm feeling anxious because, some person I care about was anxious, and that's why. So it's like, in retrospect, like the adrenaline causes the anxiety, but to feel anxious without a reason makes you feel crazy. So that's the reason why you got to find somebody so that you can feel rational and be like, oh, I am anxious because this person I care about is having some difficulties. That's why I'm worrying for him. I'm worrying for them. I'm worried about them. Does this make sense?
Oh, yeah. So COMT is responsible for breaking down adrenaline across the brain?
Deactivating the adrenaline anywhere in the body. So then that's not the only one that I know of. I mean, I'm pretty sure that's the strongest one, the most important one. There are so many different ways that you can manage adrenaline. You can deal with adrenaline by increasing your endorphins, by working out, exercising, You can do that. There are all these other supplements that are like magnesium, different like magnesium L-threonate, that definitely hastens the deactivation of adrenaline. So these patients of mine who have these mutations, I recommend all these supplements to them that helps calm their nerves. First thing I tell them is you got to exercise every morning, like at least 20 minutes, get your heart rate over 120 beats per minute and keep it there for 20 minutes. That seems to get enough endorphins to get produced. Now, endorphins last only 24 hours. That's why you got to do it every morning. So that helps them with their anxiety big time. Some of them, when they have a double anxiety mutation, they work out twice a day. And that's what keeps them sane. And they're able to manage even without prescription medicines, They definitely have severe enough anxiety where they would meet criteria for generalized anxiety disorder and certain SSRIs and stuff that helps their anxiety. But a lot of them prefer to use supplements and not take pharmaceutical drugs,
Sure.
Because most pharmaceutical drugs have side effects. Now, these supplements that I use, give them to pregnant women and ask them to get it okayed by their OBGYN, and almost all of them, actually all of them except for one OBGYN had a problem with the multivitamin I was recommending because the doses were too high in it, and he was concerned about that. But all the others have given a blank okay on all these different, they're like 8-10 different supplements I recommend to pregnant women when they're depressed or anxious. And it seems to work. I just tend to get complicated cases because I like challenges.
Yeah.
And say, the whole point of choosing this specialty was to get intellectually stimulated. So everybody has a different story, but the bottom line is one way or the other, that story is triggering their adrenaline. And that's what's good. You know what I noticed? Adrenaline magnifies whatever emotion you're feeling. Because these people with these COMT mutations, they tend to be very excitable. So when they get happy, they get super excited. They get so excited that you're like, what's wrong with you? Why are you jumping up and down over this little thing? It's like not a big deal. It's just, hey, so you were lucky, so what? But they get so excited, they can't contain themselves because once the adrenaline is triggered, It magnifies your emotion, whatever emotion you're experiencing. And so that's what when they get anxious, they get extremely anxious. When they get mad, they get crazy, like they're going to rage. And this is not a rule, but this is what I generally see.
Interesting.
And some people, they don't understand this, so they start treating somebody with a rage problem differently. They start treating them with all sorts of medications. But if they understood the basics behind it, the way I see it, now I've not read this in any book, it's just experience with people.
Yeah.
It tells me this is what happens. It's just interesting to me.
Well, that seems like a pretty big cascading effect because, yeah, anxiety is a massive problem. Have you seen like is there another significant gene mutation that a lot of people have that contribute to something that's just as profound or applicable in daily life?
Well, yes. Remember we talked about the MTHFR and methylene tetrahydrofolate reductase?
Yeah.
Now, folate doesn't cross the blood-brain barrier. It has to be metabolized from folate to hydrofolate, then dihydrofolate, trihydrofolate, tetrahydrofolate, L-methylfolate calcium. When it turns to L-methylfolate calcium, it can cross the blood-brain barrier. But there's only one enzyme that does that. It's called the MTHFR enzyme. Now, it seems like 60% of Hispanics in this country have that mutation on that enzyme. And there are multiple types of mutations you can have on that. You can have one minor mutation or one severe mutation or two severe mutations or two minor mutations. Like it's just depending on if they got it from both parents or from one parent. And so when you have those mutations, it reduces the efficiency of the enzyme. This enzyme usually works the best when you're sleeping. So let's say somebody sleeps 8 hours and they have one severe and one mild. That reduces the efficiency of the enzyme to 50%. So when they sleep 8 hours, they're able to be in a good mood and concentrate for 4 hours. After that, whatever L-methylfolate calcium was created in those 4 hours, that's 2 hours. So it just takes 6 hours. So you sleep 8 hours, you're able to concentrate well for 4 hours, and then it starts falling off the cliffs, After 6 hours, it's forget it. There's really nothing they can do except take a nap or do something else that does not involve concentration or intellectual activity. Most of the time I would hear this from them that after lunch, they feel intellectually exhausted. But then somebody else says something, they feel emotionally drained.
Yeah.
That sounded pretty good too. I never thought of it that way, but it kind of makes sense because in order to create neurotransmitters or make neurotransmitters in the brain, we need L-methylfolate calcium. So when you don't have L-methylfolate calcium, you're going to have some sort of a neurotransmitter imbalance, which will present in the form of anxiety, depression, ADHD type symptoms. So many times people with MTHFR mutations, severe ones, and not the mild ones, but the severe ones, like it's one severe or two severe, though they get diagnosed with ADHD. And they come to me on like Adderall or something like that. And then as usual, I do the genetic testing on them. And when I find that they have this mutation, so I prescribe them particular medication. I mean, there's only one company that makes it right, and that's Deplin. It's L-methylfolate calcium. It's the company that did most of the research on it, and it's FDA approved for as an adjunct in depression and also for schizophrenia. Remember, it helps with the production of neurotransmitters. So if you do enough studies, you can get it approved for all sorts of diseases where there are neurotransmitter imbalances.
Right.
So that's the only company that I've tried all the other generic or fake ones. This company never patented it, So it was never a brand name one. When somebody says there's a generic Deplin out there, I know they're lying because there was never a brand. So how can you have a generic,
So this is online. People, the extent to which you gave me the full metabolic, enzymatic process. So we'll hear folic acid, that's sprayed on everything. Not great. Go for a multivitamin that has methylfolate. Is that accurate?
If you have a multivitamin that has methylfolate, you're very lucky.
Okay.
It's hard to find those. Those usually cost a little more than $10 a month, They cost more like $25, $30, maybe $40 a month. Then, of course, there's the liposomal ones that you talked about yesterday, and those are the most expensive, but they're the best.
Right.
I can't afford those yet, but someday, maybe.
So it's worthwhile for, would you say, what are the easy things other than, genetic testing would be nice just so you know, but is folate that responsible for anything that deals with focus?
No, it's the concentration. There's a difference between
Mm.
attention and concentration. So concentration involves attention along with intellectual activity. For example, when we test somebody's attention, we ask them to spell America backwards or world backwards. Now, when we have to check concentration, we tell them to count down from 100 by sevens. Now, that involves paying attention and also doing the math in your head and not forgetting your place. Because many people, they can skip and they make mistakes over there. So just watching them do that serial sevens is what we call it. Just the way they do the serial sevens, I can tell if they're having more problems with their attention. Because they may be doing the calculations right, but then they miss, from
Right.
72, they'll say 62. Like they just are not paying attention to that part. But so the concentration requires the elements of folate calcium and just a general mood. So they wake up in a good mood by the evening, they're biting people's heads off, or they're just irritable, angry, frustrated, mad, not severely, just enough to notice. So
Right.
people learn that, okay, this boss, after lunch, don't bother him. Whatever you wanted to get approved from him, get it in the morning. You just figure it out, like when you work with people, you just figure out that they're in a better mood in the morning. Yeah. So,
And you think that mutation is like one of the biggest
60%
responsible
of
for
Hispanics,
that massive shift in people's mood as the day goes on?
not always. It also depends on how much stress you're under, how much protein you consume. Like if you don't consume adequate amounts of protein, you're just triggering these things sooner,
How would you define adequate amounts of protein?
Well, even if you look at what the government says, they say like 50 or 60 grams per day per person.
I think that is
That
so
may
low.
be that may be fine if you're totally perfect, like perfectly healthy with absolutely no problems at all. But when anybody I see in my office, I insist that they have at least 100 grams a day, every single day, at least 100. And if they're bigger, like if they're 250 pounds and stuff, I'll say 120, 125. I don't usually recommend more than 150 because even if they're 300 pounds, I don't usually recommend more than 150. Because I've had some patients, like come back with, the blood work is done, but it doesn't come back to me until a week later or 2 weeks later. And then I'll see that their BU and creatinine is off. Their kidneys are getting stressed out with all that protein because they already had some sort of kidney disease that I wasn't aware of and they were not aware of, So it's best to not stress the kidneys out too much. But for depression, you need protein. Now, this is what happens. Many people, they take antidepressants and then they'll say the medicine stopped working. I'm like, so what? The medicine decided today's Tuesday, I'm going to stop working today? No, the medicine doesn't decide that. It's what you ate or what you did not eat is what made the medicine either work or not work. This is hard for people to digest because they're used to blaming the medicine, If a pill has worked well for you, why would it stop working? Most of the time it's because you stopped working out or you stopped, taking your multivitamins or you stopped consuming protein. And usually what happens is when the medication works, people get motivated to lose weight. So they go on a diet, but they're doing a diet in a way that's wrong, which is they're cutting down all sorts of food and they're doing that intermittent fasting thing, but they're not doing the right way. By doing the intermittent fasting, they're actually starving their body of protein. So our natural tendency is to go for carbs and fats because that's what our body craves and wants to hold on to, because that was the cause of most of the starvation deaths and famines and stuff. Calories were very important. But now that we are at the point where we have kind of hacked that and fixed it with whatever genetic mutations we've done with our food, let's not go down that road. That's a little bit.
Yeah. It's a whole nother podcast. Yeah.
Yeah. So
you would say for neurotransmitter production, if someone's doing intermittent fasting or any sort of big lifestyle change like that, the adequate amount of protein for neurotransmitter production is the most important thing.
The most important, plus vitamin, multivitamins too. But you need that protein because what happens is, let's say that you go on a low, like some people do water fast for 7 days,
Sure.
But why that doesn't cause depression? Because when you're fasting that much, the BDNF production goes like 1,000%, and your growth hormone levels go crazy, like 10 times, 10x or more. So the BDNF helps you not get depressed. Brain-derived neurotropic factor. It helps fix your neurons. There's a school of thought that says that all antidepressants are boosters of BDNF, So I'm like, okay, maybe there's some truth in that. I don't know. But that sounds reasonable because increasing BDNF helps fix depression, it seems. So why not? You take somebody and they start working out, they start feeling better. The mood gets better without antidepressants, So it does work. Now, I don't recommend fasting to my patients because they're already depressed. I don't think they have willpower to be able to, do the intermittent fasting the correct way or do the water fasting the way they should, because they're already feeling down and no motivation, feeling down on themselves. They're like, by the negative self-talk. You know what I say to my patients? I tell them, think of your brain as a person. You're starving your brain, so your brain's pissed off at you. That's why it's telling you to go kill yourself, because it's so freaking mad at you. Because you're starving it. Imagine if you had a dog or you had a pet and you didn't feed your pet. Freaking bite you. So why wouldn't your brain do that? And I'll tell you, this is really true. Because when they consume a protein shake in my office, when they come in like suicidal with a plan, most doctors immediately call the hospital and admit them in the hospital. Well, I'll have them have a seed and give them a premium protein shake or something like that, 30 grams of protein. Within 20 minutes, they forget they were suicidal. 25 minutes, they start smiling. 30 minutes, they're the ones cracking the jokes. And I'm like, wait a minute. Nobody taught me this. They told me it takes like 7 days to recover from depression and all this. And I'm watching people in front of my eyes. I'm seeing them go from severely suicidal with a plan to cracking jokes in 30 minutes. So it's kind of difficult for me to ignore that, when it happens over and over and over. And that's the reason why I'm insisting on the protein, because I've seen it work magic in front of my eyes. Every 100% of the patients, it's not like 89%, 99%, no, 100% of them feel better. 100%. So how can I ignore that?
So you think people are just missing some raw building blocks?
Definitely. Because why? See, God made us pretty good, we're pretty healthy. Children are not born, some people are born with diseases, illnesses, genetic stuff, congenital anomalies and stuff. But most of us, our bodies are able to heal itself as long as you give it the raw material it needs to heal itself. If you don't have the raw material, you cannot heal yourself. Think about this. SSRIs, right?
Yeah.
What do? Well, let's see, the message is coming from this neuron. This is the one receiving the message. So this neuron releases serotonin to communicate the message to this neuron, right? But due to the fact that it doesn't have enough serotonin, it starts rapidly trying to reuptake, but the reuptake of the serotonin is faster. So what does the pharmaceutical industry do? They come up with a serotonin reuptake inhibitors, like selective serotonin reuptake inhibitor. So that, because it inhibits the reuptake, so the serotonin lingers in the synapse long enough to where this neuron gets the entire message. And that's what seems to help with depression. That's great. You can patent that pill. You can make money off it. But my thinking is, wait a minute. They don't have enough serotonin.
Right.
Let me give them tryptophan. That's what serotonin is made of, right? The amino acid tryptophan. So why don't we give them a boost of like tryptophan, which will help this neuron produce enough serotonin so that it doesn't have to reuptake the serotonin so quickly. And that would fix the problem just as well. But there's no money in that.
Right.
Therefore, you got all these antidepressants being invented all the time. Stronger ones, better ones, your SNRIs and all these things. But if you provide, like, for example, where does the epinephrine, norepinephrine come from? It comes from dopamine. Dopamine is metabolized and makes epinephrine, norepinephrine. Where does dopamine come from? Tyrosine, the amino acid tyrosine.
Yeah.
So if you're consuming tyrosine in the morning, that helps give you dopamine, which is what helps with motivation, helps with focus and multitasking, puts you in an amazing mood. Then you take tryptophan at night, which is a precursor of serotonin as well as melatonin. So it helps you fall asleep and you wake up in a better mood the next day. Then you take the tyrosine again, and now you can focus and be all energetic. And so just taking these two amino acids can make a huge difference in a person's life. Now, I'm not recommending that to people I don't know. I do it to my patients, but it's something like, for example, I'll tell you an example. Like a person who's got bipolar disorder, they take the tyrosine in the morning, they can go manic or psychotic because psychosis is caused by too much dopamine.
Oh, wow.
So there you go. And then mania is also caused by too much dopamine. So that's why I don't recommend people just start taking stuff left and right, because if you have that, if you've inherited that from parents or grandparents, this could be the thing that triggers it. You got to be careful. You have to consult somebody that knows about these things. But a lot of patients, because you can buy them on Amazon, so people just try it. The risk is that you end up in a mental hospital, and that's the problem.
So how would this be regulated through food? Like if someone, is there a specific like nutritional change that people can make, or is it usually just lack of that you see that makes a difference?
So it's not too difficult. You just Google what foods have high levels of tyrosine.
Right.
Those foods you have in the morning, like eggs. Have that in the morning. What foods have more tryptophan, like turkey, chicken? You eat that for dinner. Pretty straightforward. It's not too complicated. If you just think about it, and you can make it happen. It takes a little bit of, you have to use this, trying to figure it out. And what time of the day? Now, if you take that tyrosine at night, you'll be wide awake. You're like focused, Or you take tryptophan in the morning, you'll probably be half asleep. Like you have difficulty staying awake in the morning meetings, which is not going to be looked upon very kindly by your bosses. Right. You've got to be careful. Now, most people, they just take the shortcut. They just consume caffeine, which has been marketed as energy, which it is not.
Oh, yeah. Can you go into that? Just go into caffeine and sort of the inhibitory effects that we spoke of yesterday. That was fascinating.
So what caffeine does is it literally blocks the metabolism of catecholamines, which is adrenaline, noradrenaline, dopamine. It blocks it. So now the dopamine levels go higher. So that sort of gives you the impression that you're able to focus better. It seems like it gives you motivation and all of this. But remember, dopamine gets metabolized and becomes epinephrine, norepinephrine in the brain. So if too much epinephrine, too much norepinephrine, now you're going to get a little edgy, a little bit, anxious, a little bit easy to lose your temper. That's why people who drink caffeine tend to be inconsiderate, impatient, self-centered assholes. But that's just the risk of consuming too much caffeine. Like there are some people who are not, because they don't have that asshole gene in them, I suppose. I don't know if there's a gene like that, but I'm just kidding. But you know what I mean? Like you've got to, I tell people like, when the light turns green and those guys start leaning on the horn immediately, I promise you they're caffeine drinkers.
Yes, I would agree.
Because it makes you very impatient, man. I mean, it does. So it just kind of gives you the high levels of adrenaline. And adrenaline is a fight or flight. It's for survival. It's a survival hormone, right? So when you're thinking about survival, you don't care about anybody but your own survival. The adrenaline just makes you focus on your own survival. So you become very self-centered and inconsiderate. So whenever I get a couple, husband and wife, having problems, the first thing I tell them is stop all caffeine. They'll tell them whenever you're talking to each other, drink a protein shake. So that takes care of their neurotransmitter needs, right? Because majority of the people that I see have consumed suboptimal levels of protein, like 30 grams, 20 grams a day. That's extremely low. That protein is supposed to help you produce all your, neurotransmitters, even insulin, everything is amino acids. And then it's supposed to help repair your muscles and make sure that you don't lose muscle mass. Because the people that don't consume enough protein and they will do the fasting, they're at risk of losing muscle mass. Though a lot of people nowadays are using these, GLP-1,
semaglutide and all that.
Yeah. So GLP-1 receptor, I guess, is it? Or antagonist? I forgot. What does it do? it tends to increase your blood sugar because they are glucagon-like. Right? Glucagon's job is to increase blood sugar. So it increases the blood sugar so that you don't crave food. The reason you crave food is because the blood sugar drops. And if you ever use the continuous glucose monitor, where you put it down here, every time you get hungry, you look at your phone and it's like, oh, my blood sugar is quitting below 90. That's why I'm feeling hungry. So you can tell. And then you learn that, okay, if I eat this, my blood sugar spikes. When I eat that, it doesn't spike so much. So maybe I should eat that and not this. That's just something that you learn. And it's a very good way of trying to, it's like a biofeedback. It's like you're getting feedback from your cell phone and this monitor as to what is causing your blood sugar to spike. So if you're trying to lose weight, you can follow the things that are causing insulin spikes, because whatever causes a glucose spike is going to cause an insulin spike.
Right.
Which is, you want to keep those as low as possible. The insulin levels as low as possible if you want to lose weight. So
I didn't know we are going to get into weight loss. This has been very helpful. Are there any, so we went over depression, anxiety a little bit, ADHD. You mentioned Asperger's and autism at the beginning there. Yeah. Are all of these distinct, and are the genetic mutations that you find distinct for them, or are there just common patterns for all of these?
No. I haven't really. I think the jury's still out on that as to which mutations. Now, there's one that I test for is DRD2, which basically tests for the density of the dopamine receptors in the frontal lobe. So how much dopamine receptor density you have. Now, if you have a mutation on it, one mutation, that means this density is lower, which eventually means that you need more dopamine to make sure all the receptors get stimulated. When you have a whole bunch of receptors, a little bit of dopamine is good enough. That means you don't have the mutation. When you have the mutation, now that doesn't mean that they have ADHD. Frequently, ADHD, patients with ADHD have that DRD2 mutation. But there are other dopamine receptor mutations too, but the only way, I think the reason we check that is because insurance pays for it. I suppose. I don't know, because usually it's a lot easier to order stuff that insurance is going to pay for, because if they don't pay for it, it can get really expensive for patients, especially if they are not looking for something like that. Very rarely do people want to get certain types of genetic testing, specific testing. Very, very rarely, because most people don't know about it. I mean, most doctors don't know. They don't know how to read them. It's kind of embarrassing when I tell my patients to take their genetic testing and show it to their primary doctors, and they don't get any feedback from the doctors. Like, those doctors probably just look at it. I don't know if they even learn anything from it. Because I've had some patients come back and tell me, like, I told the doctor I can't metabolize this medication, but he prescribed it to me anyway.
Interesting.
And then there's a funny thing. I had a patient of mine. I couldn't prescribe her anything. Whatever I could prescribe her, I had prescribed her, it wasn't working. So I wanted to give her a certain course of treatment. The insurance, of course, denied it. I was talking to that doctor, and I told him, but she's a poor metabolizer on this pathway. That medication is not going to work on her. She's a kid. So FDA-approved medications are only so many. And that one affects her. You heard of Effexor? It's depressive. It's metabolized on a CYP2D6 pathway, and she was a poor metabolizer on that. So I knew that was a bad idea for her. So he's like, well, there's no research that says that if you give somebody a medication they're poor metabolizers of, that it won't help their depression. And I was like shocked to hear that. I was like, that is so unbelievable. Like, granted, yes, maybe there is no research showing that, but it's like common sense,
Right.
If you can't metabolize the medication, how the heck is the medicine going to work for you? It's definitely going to cause side effects or some problems. It's never going to work like you expect it to. So I couldn't even say nothing to him. So they wanted me to put her on that medication before they would approve the next level of care. So now I got to wait for that kid to come back and see how she's doing and tell her, like, sorry, but your insurance won't pay for this. So we got to try this, even though I know for a fact it's not going to work, but I have to give it to you because I have to document that. And you got to take it. If you have any side effects, let me know. But if you don't, then just take it. And if it doesn't work, that's okay. We can go to the next treatment level, So it's just interesting how people interpret genetic testing.
Right. Well, yeah, I don't think it's well known, like you said. Are there any, so you mentioned protein, you mentioned sort of working out or exercise or resistance training. Are there any other big lifestyle factors that you found that sort of hit major pathways and help all of these different,
Yeah.
what have you found?
See, different people have different, they have a preference. For example, if somebody has ADHD, they tend to like jobs that involve physical activity. So I frequently see people with ADHD or mechanics, or they're like waitresses. Now that doesn't mean everybody. Like, there's certain people with ADHD that have very high cognitive skills, and they can be doctors, lawyers, and things like that too. It's just that they tend to gravitate towards the mechanics because it's you work with your hands. It doesn't involve as much concentration and focus. And what happens is if you don't do it right, the car won't start. So you're going to have to fix it. Like you forgot to put something, because forgetfulness is the most common symptom that you see in ADHD. But it is always there. They've always been forgetful. It's not like at the age of 45, they become forgetful. That could be something else, But people with ADHD are known to be forgetful. Only because they live in the moment. The entire concentration is in the moment, whatever they're doing. Out of sight is out of mind, for real. And it's not their fault. That's just the way it is. So
I can think of that being a gift too.
yes, because why do people have PTSD? I mean, why do people have anxiety? Because they can't forget certain things that were traumatic.
Right.
So those things, they keep recurring. I'll tell you this. So I had this patient once, and he was traumatized, and somebody sent him some nasty pictures of his girlfriend having sex with him. That must be a special type of sadist who does that to the boyfriend of the girl that he's, messing around with. So he got traumatized by those pictures. So he came to me, like he couldn't function. Then I find out that he's on a severe, ketogenic diet. Like he has 190 grams of protein. He works out, has almost no carbs at all. Now, one of the things that happens when you go full keto is you start having your brain, it burns. So ketones burn clean. Ketones
Right.
help your brain function a lot better than carbs. Carbs kind of give you that brain fog, and after you eat too many carbs, you get sleepy. Not so. With ketones, it keeps you alert, and your memory becomes almost photogenic. So after having tried multiple medications and all kinds of things, I finally said to him, you know what, to be honest with you, this is the reason why you cannot forget that. Because because of the type of diet you're eating and you're working out all the time, that's gotten you to have this type of photographic type memory. And he confirmed, he's an engineer, so he confirmed that yes, his memory is amazing. But see, that same amazing memory was messing him up. So I told him, do me a favor, start eating carbs. Start eating carbs. He ended up gaining 10 pounds, but his symptoms went away.
Interesting.
Like his PTSD gone, right? Now, this is the only guy I ever said that, because most of my patients, I have to tell them to exercise. Because exercise gives you endorphins. Endorphins calms your nerves down, and it sort of helps with the PTSD symptoms, which gets triggered by adrenaline. In this particular case, it was triggered by his photogenic memory, which was enhanced with the ketogenic diet that he was taking. So he had to go off ketosis so that he could have some brain fog and stuff and forget those pictures.
So he had to dull his PTSD.
He had to dull his intellect and his excellent memory so that he could forget all that stuff.
Oh.
And it worked amazingly. Like 2 weeks, he was doing better. 4 weeks, he was cured, fixed, Now, that doesn't happen most of the time. Most of the time, I have to insist that they exercise regularly and quit the darn caffeine, that's the biggest issue. Because it's so addictive. It's impossible almost to quit caffeine. So, this is the thing that nobody talks about, like how PTSD gets triggered by caffeine. I haven't read that anywhere either. And I seriously believe that because I've seen people who had this, and when they stop the caffeine after about 21 days, you start going into deep restorative sleep, which you don't get in when you're drinking caffeine. And you may not know this, but even people who drink half a cup of coffee a day, every single patient I ask them, do you wake up refreshed in the morning? And 100% of caffeine drinkers say that they don't. they wake up exhausted. Because the older you are, the longer the caffeine lingers in your system. Then what does caffeine do? It blocks the metabolism of adrenaline, so your adrenaline levels are much higher. So when you go to bed, you may fall asleep. But the adrenaline being higher, you don't go into deep restorative sleep until like 4 in the morning, when you have metabolized all the adrenaline, depending on what mutations you have or don't have. And then 4 o'clock, you go into deep sleep, and then you got to wake up at 6 or 7, and it's like inadequate deep restorative sleep. So you're trying to get up from this level to this level of alertness. So you feel like you're dragging, like it's so difficult to get from deep sleep to fully alert. But when you don't consume caffeine at all for at least 21 days, after 21 days, you start going into deep restorative sleep, and you go into deep sleep at 11:30. By the time it's 6 o'clock, you're naturally waking up, alert, focused, no tiredness at all. Like, don't feel exhausted at all. You wake up like you wake up when you were a kid, you jump out of bed, you start singing, you start humming, you kind of sing in the shower. I mean, I'm telling you, if a person sings in the shower, they're not depressed. It's impossible. It's impossible. Because depressed people, that's the last thing on their mind, like they're worried about all kinds of other stuff. So that's my goal, is to get my patients to start singing in the shower. That means they're getting good restorative sleep, they're refreshed, and they're not depressed. They're actually enjoying life,
Have you found a good way for people to come off of caffeine? Because it is I've struggled with this for about 5 years. I just made an Instagram post about this because I basically came to this realization. I didn't know it was that bad, and I didn't know it took 21 days. So that explains a lot. But do you have other than going cold turkey without, is there an effective protocol you found to help people get off of caffeine without wrecking their entire productive life?
So what helps the most is education. See, if you understand what caffeine is doing to you, you're aware. You have to be mindful. You have to be aware of what's going on. Once you're mindful of it, then you'll notice that, I didn't drink caffeine and some guy cut me off in traffic and I didn't get the palpitations I always get. Drinking the caffeine will give you that. Now, everybody has that, depending on what anxiety mutations you have and all that. There are very few people who can manage all that without getting tachycardia. Because, your life is almost threatened, You have to slam the brakes on because some guy just suddenly decided to switch lanes, didn't tell anybody about it. And that's the concern. So one of the things I found that works best is if you're drinking coffee, you just switch to decaf. So that lowers your caffeine from 125 milligrams, 175, depends if you're drinking Starbucks, is probably closer to 175. You're making coffee at home, it depends on how strong you're making it. So 100, 125 milligrams of caffeine. You go to decaf, you're down to 10, 15. Some decafs have only 2 or 3 milligrams of caffeine. That makes sure that you don't get the withdrawal, the headaches and the brain fog and that listlessness, that you have no energy. That doesn't happen when you're drinking decaf. Maybe it's a placebo response. Maybe it's a little bit of caffeine that doesn't let you starve of the craving doesn't come up because you're consuming some. So when you go this, you're drinking 3 cups of coffee a day. When you go to decaf, you may have to drink 5 or 6 cups, but you still get less caffeine than you did with full caf. Now, some OCD patients will do half caf and half decaf. And I'm like, what in the world? Because they're OCD, right? So they have to do everything a certain way. And that's pretty much I'm not saying it's a diagnostic thing, but when people are doing that, I know that they've got some issues with being a little obsessive about stuff. Things have to be equal. It's just interesting. How do you tell, how do you figure out what's going on with them? And one of the best
can cacao, the raw form of chocolate, be effective at that as well for the caffeine? Because it's got a little bit of caffeine in it.
Not a little bit, there's a lot of caffeine. The dark chocolate.
I thought it was 10 milligrams, 10, 15.
The dark chocolate, it has 75%, 85%. That's loaded. Because I have some patients. Yeah, I check the urine for caffeine, okay? My patients, I check the urine for caffeine. Because, caffeine interacts with stimulant medication like Adderall, Ritalin, all those medicines. It does interact because it's like doing speed and cocaine together. How greedy can a person be, right? So you don't do both. You just know that. You just know that just naturally, you know, say intuitively, you know that's stupid. You don't do that. So when people are doing a mild stimulant with a strong stimulant, it leads to a drug interaction. Now, what does caffeine do? It blocks the metabolism of adrenaline on the back end. Now, what does the ADHD medications do? They increase the adrenaline on the front end. So now, this is raising the adrenaline. This is not letting it come down. Caffeine is not letting it come down. So these people have like severe rage problems, anger problems, hypertension, tachycardia. Sometimes they have skipped beats, you know, arrhythmias. I've had patients complain of that. Sometimes they have chest pain. And I tried to talk to them, like most of the kids with ADHD, you know, they're young, so their hearts are pretty young. So they're able to tolerate it, but I don't want them to do it because you never know when one person will not be able to tolerate it. I've had a guy in his 20s, his wife was giving birth to a kid. So he was, you know, waiting and he was awake. It was the middle of the night. And he had worked all day. He figured he can have some caffeine, no problem. I told him don't. So he goes and has a cup of coffee. Next thing you know, he's in the emergency room with chest pain. He's like 22, 23 years old. He's very young. I didn't expect that. So he ends up in the emergency room. His wife is giving birth and he's in the emergency room too. Anyway, it all worked out. Nothing happened to him. I'm not sure exactly how they treated him, but he was okay. But they set him up an appointment with a cardiologist. So the day of the appointment, he tells the cardiologist, should I take my ADHD medicine? Cardiologist said, yeah, sure, no problem. So he takes the ADHD medicine. The cardiac workup is perfect. No issues, nothing. It was totally normal. And I'm like, that makes sense. That means that caffeine, he was taking the ADHD medicine every day, he didn't have chest pain. The minute he mixed it with caffeine, he ended up with chest pain. So I explained it to him. Now, he's not the only one. I have another person who did something similar during COVID. You know, he was drinking caffeine and he would have these tachycardia and like arrhythmia type stuff that he didn't quite understand what was happening. So his mom from India connects with me and sends me a message, and then a friend of his father's, the cousin of mine, so he tells me that I need to figure out what's going on because nobody else seems to be able to figure it out. So I sat with him like for a few hours and talked to him in detail, like what's going on. Finally, it came down to, okay, that he does drink a little too much caffeine, which most doctors themselves are drinking caffeine. So they have a blind spot. They don't even ask about the caffeine, you know? So I told him, how about trying to get off the caffeine and see how it works, you know? And he was able to do that. And then he saw that all his symptoms went away. I was very happy for him. It's just like when you get these type of results from people who had symptoms and now they don't have symptoms, no prescription medicine, nothing, just that one thing, stopping the caffeine, that's it. Majority of my patients don't listen to me. That's why I have to caffeine, you know? Like I have to confront them like, okay, you say you're not drinking caffeine, but look at that. You got like, the lab stopped counting the caffeine because with 2000 nanograms, like you got so much caffeine, the lab stopped counting. So think about how much you must have had. I don't even know. Because if the lab counted it, who knows? It may have been 4,000, 8,000, who knows? So I tell them like, you got to cut back. This is not okay. But that's the part that I'm so glad I found a lab that actually does it.
Yeah.
Because then I can take a lot of people with panic attacks, you know, they'll be on like clonazepam or Xanax or something. And then they drink caffeine. And it's like, oh my God. That is the one thing that for sure, when they do research on panic attacks and they want to see if a medication helps, they actually have these panic patients come in and give everybody a cup of coffee so they can have a panic attack. And then they use the medication to see how much it helps with the panic attack. You see what I'm saying?
Wow.
Like, think about it. In research, they use caffeine to trigger panic attacks. And these people with panic attacks are drinking caffeine. And I'm like, God, I mean, that's the one thing you shouldn't be doing with your panic attacks. Please, insomnia, panic attacks, hypertension, seizures. You shouldn't be messing around with caffeine at all. But it's so addictive.
Well, it's so common and it's part of like productive cult. That's why I'm just like, this is not good. Because I mean, I've recognized this, but I didn't know it's so normalized where people are going to be like, whatever. But if it has all of these effects.
There was the time when cigarettes were normalized, remember? In airplanes, you still see those freaking, I can't believe we are flying those so old. The airplanes are so old that they are like ashtrays in the airplane.
Oh, yeah.
Have you seen those?
Yes.
So The cigarettes were normalized. Doctors used to smoke it. Come advertisements on TV would show the doctor smoking and saying it's a good idea. I mean, how messed up were we? And then came to alcohol. Like almost everybody every evening would be drinking beer and stuff like that. It was considered normal until it wasn't. And then research came in and said that no amount of alcohol is safe for your brain because it's going to kill your brain cells. I mean, so that's a good enough reason to not mess with that.
Is there any other substance that you found that has so many like across the board contraindications for like any mental health thing that people are probably taking in every day?
You want me to talk about fluoride toothpaste?
Oh, fluoride.
I mean, research has shown that it drops your IQ points, right? I don't remember exactly, it was 6 points, 11 points, two different research studies that I read talked about that.
Mm-hmm.
But my thing was, if it causes any drop in IQ, I'm not interested. I don't want to do that. The non-fluoride toothpaste definitely costs more than fluoride toothpaste. And fluoride, I don't know if the government is putting fluoride in our water. You're the water guy. You can tell me.
The water treatment plants are, it's a state-by-state EPA mandate usually, and the states can choose to reject it. But I didn't know it had. Do you see that it specifically has, yes, it is definitely I don't know why this is an argument online still. Like, it is definitely a neurotoxin. Or maybe you should explain this. What have you seen since I'm just the water guy?
To be honest with you, I'm talking from my own personal experience. There was a time when many years ago, like 20 years ago or more, there was a dentist and I had some sensitive teeth. So he gave me like 4% fluoride toothpaste. That's freaking high. Okay. If they do the fluoride treatment in the dentist's office, that's 5%. This was 4%. The entire tube was 4. So normally it's like 0.4% or something. This was 10 times more. And what I noticed was spiritually, I became blunted. What that means is that I was just no longer interested in any spiritual stuff at all. Like I was living my life, but where I used to be very interested in spiritual things, now I wasn't. For like 10 years, I was using that toothpaste, I definitely wasn't. And I've got some people, like an endocrinologist once said that it causes calcification of the pineal gland. And I don't know if that's entirely true, but that's supposed to be a very important part of the opening up the third eye, is what I've heard.
Center of the spiritual, yeah.
So that part, I definitely felt it. I didn't know.
So you felt numb in your spiritual life after
taking that 4% yet.
Oh, wow.
I didn't notice it until I got off of it. And I stopped fluoride, and then I became more sensitive to, spiritual things and more interested in reading about it and, practicing it and all that. So I'm like, why did I stop practicing? So then when I got that, I listened to a lecture by an endocrinologist, and she was an Indian endocrinologist, and she was mentioning that it was calcification. And I'm like, oh, okay, maybe that's what happened to me. So now boron is supposed to help fix that. Now, where do you get boron? So I take a multivitamin, the Tangy Tangerine 2.0, it has boron in it. So that helps me out. I found that to be the best one. I've compared it to all the celebrity vitamins.
Tangy Tangerine
2.0. Yeah, it's the Youngevity is the company that makes it. It's Dr. Wallach I told you about yesterday.
Oh, yeah, that's right.
Yeah, he's the one that started that company. But he has sort of made it a point to not use any profits from that company for his personal expenses. He survives on books that he writes now, I think. Great guy. I don't know if he's still alive, but he must be in his 80s or something by now. And he's a very interesting fellow to read about.
That is the most common thing I hear working in water is, it's good that it brings people into water. So it's not like the chromium or the nitrates or any of the other toxins. It's either chlorine or fluoride. And people are just like, I don't want the fluoride. And thankfully, some cities just don't use it because, my opinion, I don't know why it was ever just put in the water. Like, it should not be consumed in general. It's a neurotoxin.
I did read somewhere that when, this USSR, the amount of fluoride they were putting in their water was way higher than what we put in the water.
Oh, yeah.
Because it helped keep people dumb and calm. So it's easy to control.
It's a sedative for sure. Yeah.
So that's interesting that this, communist countries used to use that to keep people under control. I think it's best that we get rid of it because if it's going to stop you from, using your abstract thoughts, because spirituality is abstract.
Right.
So what is the difference between an Asperger's patient and a regular person? Asperger's patient is very concrete in his thinking, very literal. A regular person is able to understand, abstract concepts. Right? These guys, they don't understand sarcasm. Like, they have a difficult time because they are so, even when they speak and the way they describe things, they're so literal. They do very well in engineering because engineering is like very exact science. Computer programming, they do great in it because it's exact. It's not like philosophy or, like they wouldn't be interested in those subjects anyway. Because for that, you need abstract thought. And for abstract thought, I feel that fluoride interferes with abstract thought. You know what? I should start telling my Asperger's patients to stop using fluoride and see if that makes any difference. Maybe I'll do that from tomorrow. Start recommending that and see if that makes any difference. Because you know what? We don't really have a cure for it anyway. Did you know that there's a school of thought that says that ADHD is the mildest form of Asperger's or autism?
No, I didn't.
I didn't either. I heard child psychiatrists talk about it. He was from India, and he was talking about it like the mildest form of autism is ADHD. I used to think that it's Asperger because a lot of kids with Asperger's have ADHD also.
Right.
And I've seen kids once I treat the ADHD, the Asperger's disappears while the medicine's in their system. And the medicine wears off, the Asperger's comes back. It's amazing. Like when they're on the medication, they can make eye contact and they can do everything like a normal person. And you can ask them complicated questions that involve abstract thinking and they can answer them. But the minute the medicine wears off, their eye contact goes like totally sideways.
So the circuitry is there. It's not like it has to be retrained from scratch. It's just something isn't connecting.
It's more like there's some difference in there, or rather some of them, need more dopamine. Now, the treatment for autism with behavior problems is like risperidone or Abilify. These are antipsychotics that are like anti-dopaminergic drugs.
Right.
So that's confusing. Like, wait a minute. It seems like a lot of the kids with ADHD and Asperger's and autism tend to do so much better on Adderall, for example. And that's what I've seen is that when they have the COMT mutation, they do better on Adderall. But they don't have any COMT mutations, they do better on the Ritalin type medications, Propylene, Ritalin type medication. That's just personal, experience and something I've noticed. And so it's interesting, like the genetics, like it's funny, like when I think of patients, I think of them based on what their genetics are. Like I don't know their names, I know their faces, but I also know that they were this mutation, that mutation. It's weird that it sticks in my head.
Yeah.
So look at the mutations, like I identify that person with the mutations rather than their name, which is interesting right there.
And that's very interesting. Yeah.
See, it's like, whatever you're interested in, you tend to sort of align that. Like,
Right.
I guess you would remember people from the type of water they have, like Midland water, So
That's
see
true.
people in
Yeah.
Midland,
How I
like,
come to be associated with them. Yeah.
oh, you're the guy that has that too much of that.
Yeah, that's true.
What is that, zebra molluscus or whatever you told me.
To
So-
close out the fluoride loop real quick, my whole point on it is just, it's a weird argument that you put it in the water for dental health. It's like, it's not good in any dose to drink. Why wouldn't you just say, if you want to use toothpaste, don't put something in the water? It's forced medication. Like at its core, there's
without
no
consent.
great art. Yeah, there's no consent. It's not a good. We don't put anything else in the water other than chlorine to kill everything.
See, when you know it's a neurotoxin, that
Right.
itself should stop you.
I think some people
Unless you
even
want to
debate
lower
that.
the IQ, you want to lower the IQ of the entire country.
Right.
Okay, then that could be a pretty sinister motivation. I don't believe anybody would do that on purpose. But intentions are good. But you know what? Forget teeth. If my brain goes, I don't care about my teeth.
Well, there's also holistic dentists. I think people miss that part. It's like there are entire categories of dentists that do not use fluoride and they don't have worse results. Like I've used one for a long time. I don't understand the disconnect between even the profession that defends it. Some of them don't use it. I don't understand where the like dissonance is there, but
I've heard of surgeons who treat brain tumors. They never use a cell phone.
correct. Yeah.
Like they will look at the person and they'll go to the hospital and then on landline they'll call them. That's something, I don't know if that's a powder cake that's going to blow up in our faces someday, but people that carry these women that carry their breasts, like in their brow or something.
Yeah, breast cancer and testicular cancer and all the places that it's next to tumors. There's the next frontier is definitely, I work in non-native EMF. So all these electromagnetic fields, not even the ionizing radiation, like it's not intuitively good to hold something to your head that's getting warmer and warmer and warmer. You feel yourself being irradiated, but it's such an integral part of our lives now where no one likes to think that all the tools of the modern world are slowly making us sick, essentially. So now there's EMF protection, which I have on my phone, and there's all of these new technologies, but at some point it gets to a point where we just go, what if we just don't use all this? Like we have to buy all this technology to counter the effects that the new tech is giving us, opposed to just sort of turning back the clock a little bit.
Yeah.
There's an absurdium point.
Yeah, I think there was a time when somebody made a decision in favor of money versus what's best for everybody. And since the effects are they come in later.
Yeah, these are all long-term things. No one does there's no such thing as a long-term study on any of this new tech. No one waits 20 years to see what it's going to do. They just pump it out and we're the long-term study.
Yeah, that's sad, isn't it?
It is. Yeah, it's kind of dark. Yes. All right, let's bring it back to mental health. Closing out a little bit. So are there, other than we got protein, so got raw building blocks through, lifestyle change, through exercise and plenty of protein, amino acids for all the neurotransmitters. Are there any big, actually, this is a good one.
Two more.
Two more? Go for it.
The vitamin D, which over 90% of my patients seem to be deficient in. Unless they're taking supplementation, there are three actually. There's omega-3 fatty acids too. Now, it seems like depressed people have inflammation in their brain. I don't know if it's the chicken or the egg. If inflammation causes depression or depression causes inflammation, I'm not sure. But I do know one thing for sure, is that when you take high doses of omega-3 fatty acids, it reduces inflammation in your entire body. So every patient I see first appointment, I'm like, yeah, you need to take this.
What would you call high
doses? 95% of my patients are low in this because I check it.
What numbers do you look for? What would you say would be a high dose?
It kind of depends. Like I found this bottle on Amazon that has every serving has 6,000 milligrams of omega-3. So I take that one, and that's the one I recommend to my patients. It's like the serving size is 2 pills. So I say 1 pill in the morning, 1 pill in the evening, and just keep taking that until we get the blood work and genetic results.
Is this
back.
fish oil or is it cod liver oil?
Fish oil. It's fish oil.
Yeah. And you test afterwards and you see omega-3s go up?
So it takes a while to get the results back on the omega-3. Sometimes they come back in 2 weeks, but usually it's 3 or 4 weeks. And I already know 95%, there's only a handful of people that had normal omega-3 levels. It was surprising. Guess who? One of them was a Down syndrome kid because she was adopted. So her mom would make sure she got all the vitamins and omega-3 since she was a kid. So she had not, I was surprised. That's the last person I expected to have normal omega-3. She was the first person I saw in my practice that had normal omega-3. Then I got some other ladies, who have been taking care of their health obsessively.
Of course, what does normal mean? Or what's your definition of normal?
Some normal regarding the omega-3 levels?
Yeah. Yep.
So it's 5.4 is what it says. It should be at least 5.4, and you need a certain amount of EPA and what is the DHA?
Yeah.
So the EPA helps with inflammation in the cardiac region, and The DHA helps with the brain. So the one that I'm talking about, the 6,000 milligrams, it has higher levels of DHA. Right. I have so it has got like 2,400 milligrams of DHA and 1,800 of EPA.
Gotcha.
Yeah. It's not too expensive, like $29.95 or something.
Is there a ratio of like, is it the amount of omega-3 or is it the amount of omega-3 compared to omega-6?
Compared to the omega-6, yes.
What's your ideal ratio?
So it depends on who you talk to. Now, in the lab says anything from 1:4 to 1:16 is okay. But no, ideally it should be 1:1. But that's aiming for something that's probably not going to happen. So if you get 1:4, you're good. But as far as the lab, they report 1:4 is like amazing.
Right.
And even 1:10 is okay. But see, when you know that there's inflammation in the body somewhere, then you should be aiming for that 1:4 or 1:1. So that's what I believe. So that's what I aim for. So I thought, because see, every single thing that's fried that you've eaten in your whole life is probably fried in cheap omega-6 type of oils, because omega-3 oils are expensive.
Right.
And at least the oils that don't have omega-6 as much, those are expensive. Avocado oil.
Yeah, there's omega-9, there's omega-3.
Yeah.
I've heard 1:1 as well. And so when I did my blood testing, this was a couple of years ago, I used a company that did a before and after test, and I started at 30:1 omega-6. And they're like, this is pretty normal for like standard American diet, 30:1. And after just 3 months, and it was just a specific, balanced oil with, I think, oleic acid, so an olive oil polyphenol to protect it from your stomach acid so it could actually absorb. It went down to 3:1 rather rapidly within 3 months. They do a before and after test. And I was like, that happened quickly. So it wasn't insurmountable, which is really nice.
That's great. I mean, do you feel any better?
I felt a little less foggy after that. I mean, I eat pretty well, but just that 3-month period was focus was the thing I noticed mostly, especially when I was doing podcasts or just talking continuously. It wasn't so much grasping for concept or words. It was more fluid. That's the thing I've never had a tremendous amount of body inflammation, no real huge pain, but mine is always mental quickness usually. Yeah, but that was interesting to see the dramatic shift in actual blood work and to know that you can actually replace it and change it, within a season, instead of it taking you, it took years, decades to get there. So you can actually change it out pretty quickly. It was nice to know.
Japanese people are pretty high. Like they eat a lot of fish.
Yeah.
And they I think I listened to a podcast or something that said that if your omega-3 acid levels are higher, your life expectancy is extended. I mean, that's great. Because
interesting.
Like people in Japan, with them like 9 to 12 sometimes, it's pretty high.
Oh, wow.
And that's amazing. That's great. I just don't know if that's even possible with the...
So they have the opposite. They have 9 to 12 omega-3 to 6 rather than the reverse, which we have.
And they live so long. I mean, can you tell the age of a Japanese person? And you can't really tell if they're like 20 or 30 or 60 or what, and they look the same.
That's true. Okay, so we got vitamin D.
The vitamin D and iron. These are two cofactors that our brain needs in order to produce neurotransmitters. So a lot of my patients are deficient in both. And I guess it's the Midland sun, it just burns you. Like, it's like, comes down on you like crazy. So most people, you just can't tolerate that sun. Supplementing orally with vitamin D is the best thing you can do. And the iron, what I found best was chicken livers. Like if you have low iron, you eat chicken livers. And there's some
liver is very high in iron.
Yeah. Now, one thing, so I have patients that'll like make a face, as soon as I see chicken livers, they'll make a face.
Right.
And I try to explain to them, when you're deficient in something and you eat something that's rich in that thing that you're deficient in, it's going to taste amazing. That's just a fact. Because your body's craving it. Now your body's finally getting it. It's definitely going to taste good. But see, they may have tried chicken liver when they didn't have an iron deficiency and they didn't like the taste.
Yeah, liver doesn't taste great.
Well, it depends. It depends how you prepare it, and it depends on how deficient you are in iron too. So if you already got enough iron, then you probably not like it because your body doesn't need too much iron, because that's a problem too. Too much iron causes anxiety,
Right.
like restlessness and pretty significant anxiety. And it's interesting that once a month I'll get somebody who shows up for anxiety and they're like ridiculously high iron levels,
Did you mention yesterday something about one of the molecules chelating to iron and preventing absorption? Was it caffeine
Yeah,
or
that's
something?
caffeine and tannic acid. So caffeine binds the iron and doesn't allow it to get absorbed into your body. So it stays in your gut and you just poop it out. Yeah, and I see these guys, people that drink like iced tea,
Yeah.
unsweet tea after their meal or with their meal.
Yep.
Now, remember, we talked about not mixing up stuff and messing
Water
up
and
food.
food.
Yeah. So the iced tea is definitely one of those, but iced tea also interferes with your iron absorption. And that shows, like a lot of the people we hear in Midland, they drink iced tea with their food.
Mm-hmm.
So I'll see these guys in the oil field, they come in all bodybuilder type, working out in the gym with big old muscles. They're low in iron. It's like, what in the world, like, then I find out they're consuming caffeine, too much caffeine.
That tends to go with bodybuilding. Yeah, it's a good pain suppressant.
Well, so it's a spasmodic agent. Caffeine is a spasmodic agent, literally causes muscle spasms. I mean, a certain amount is allowed in the Olympics, but after that, they take away your gold medal if you have one. Too much caffeine, you lose your medal. I mean, it definitely improves performance, because it causes a spasm of your muscles. And I know this for a fact because, I've tested it. And it does. You can lift 5, 10, 15 pounds more than what you ever did because of the caffeine. But it's not a good idea because you're straining your ligaments and your joints and your tendons. And you're going to end up with a torn bicep. You're tearing something up that you don't want to. Like injuries are more common if you're using, because you're artificially boosting the strength of your muscle.
Oh, I see.
Your tendons and ligaments being prepared for it.
So I always attributed it to just giving you sort of more energy and pain reduction, but you're saying that it's literally pushing you past what your body is able to withstand. So just more likely to get injured.
Yeah, naturally able to lift. Now, I'm not saying that so people can start drinking more caffeine. That's a bad idea. A lot of people with back pain, neck pain, muscle spasms, they don't realize it, but if they stop the caffeine, they will lose their back pain completely. But nobody ever stops it. They go and get surgeries on their back, but they won't stop the caffeine. I had a patient like that once. She came to me. She was a waitress, and she came to me and she wanted to be on ADHD medicine. She had ADHD, but she was drinking waitresses get unlimited coffee for free. So she was drinking like 4, 5, 6 cups of coffee every day. And I was like, sorry, I'm not going to give you any Adderall if you're going to be drinking caffeine. So first quit the caffeine. I'll see you next week. She comes back next week. The first thing she tells me, oh my God, my back pain is gone. She said, I had surgery on my back and that didn't fix my back pain. But stopping the caffeine, my back pain went away. Like no pills, nothing. She's totally fine. She was surprised and very happy about it too.
Yeah, I bet. Back pain just sucks the joy out of life.
Oh yeah, it does. But see, most people don't realize. So whenever I get back pain or neck pain, I'm taking magnesium supplementation.
Right.
I take magnesium. And I don't take painkillers. I take magnesium because it works like magic.
And you said you like L-threonate?
Magnesium L-threonate definitely improves the adrenaline clearance. It helps get rid of adrenaline from your body and crosses the blood-brain barrier and directly calm the nerves down too.
So glycinate is usually talked about in that way. Does it also do that, magnesium glycinate?
Glycinate does not cross the blood-brain barrier, but it does get absorbed quite well. Okay. So majority of your magnesium is inside your cells. So I check the RBC magnesium, which is the intracellular magnesium, along with the serum magnesium too. And if I see somebody with low RBC magnesium, I recommend that they take more magnesium because they're probably not getting enough of it. So, I mean, it does help. Definitely. People with that, the double COMT mutation.
Yeah.
And they take magnesium, it helps because the problem is people with anxiety, they tend to excrete too much magnesium. Right. It's just similar to people with, chromium, the natural chromium.
Yep.
Levels in the United States in 1940s were like 28 to 1,000. That was normal. In the 80s, it went up to like 0.2 0.1 or 0.2 or something like that. I doubt anybody has any chromium left anymore. So when you consume carbs, you lose a lot of chromium. So that's why eating carbs is not healthy for you. Definitely, it causes you to lose chromium, especially refined carbs.
So just heavy mineral depletion. It increases the rate of mineral depletion.
The chromium depletion. The chromium is very important for blood sugar, maintaining blood sugar. So what tends to happen is when you get chromium deficient, you tend to get hypoglycemic first. And then longer period of chromium depletion seems to cause diabetes or pre-diabetes to start happening.
Oh, wow.
So there's a certain supplement I get from Amazon, like vanadium and chromium.
Yeah.
And when I take that, my sweet tooth goes to sleep. Like my sweet tooth is, I don't have to worry about my sweet tooth anymore. So I take like 1 or 2 pills in the morning. I usually take 2 at a time now and 2 in the evening. But if I miss it for a couple of days, I find myself, looking for chocolates and candy and stuff like that. Oh my God, it's like crazy. The craving is bad, like the caffeine craving that people have.
Do you know what foods have chromium in decent doses naturally? I've never even looked.
Oh, I really don't know. I'm sorry.
Yeah, it's one of those things that I just have never heard about, chromium, which is surprising. But I'm not surprised because metals and minerals we're just very, very deficient in because the food just doesn't have as much as it used to either because of soil depletion.
Exactly. Because we've got the industrialized farming,
Right.
So they just, now the plants, they need only N, P, and K, like 3 minerals.
Yeah.
We need 60.
Right.
So,
well, the plants need more too. We just are cheap and the plant. So I was a farmer for a while. So this is kind of how I came to nutrition. The plants need all of them as well, but they will grow just given the basics, nitrogen, phosphorus, potassium. But they're supposed to supply all the trace minerals, but we don't put them back.
Exactly. See, the plants have no option. Whatever is in the soil will get in the plants. If there's cadmium, which is supposed to be pretty bad in the soil,
heavy metal.
Heavy metals will get into the plant too. So the plants, that's their nature. I mean, they suck up minerals and water and everything from the ground, and that's how they live. That's how they survive, right? So they can't help it. But, plants that grow in places that have these rare earths and amazing minerals, like, for example, like the glaciers in the Himalayas, they are pulverizing the millions of years old sand that is underneath them.
Yeah.
And when they melt, the people in that area, Hunza and all those areas like northern Pakistan, they have a way of doing their farming where they, on the hill, they'll go like this and they will create these ditches that go like that so they can water from the glacier. They're getting all their plants, watered and irrigated through that. So that food, those fruits can freaking cure cancer, because they have all these amazing minerals that have been proven to lengthen lives of, like, rats supposed to live for a year, but when they take these type of minerals like germanium or mercurium or whatever, all these country named ones, they tend to get their life extended up to 4 times, like 4x. Can you imagine that if we started doing that and if it worked, we'd live to 400 years?
I'm the more I learn about nutrition and how the human body works and about environmental toxicity, I just kind of become more set in my ways of we're just under everything, under mineralized, we're just consuming so few nutrients compared to what would be ideal. And all of our RDAs, our benchmarks, were set during a period of malnutrition anyway.
No, they were set up to prevent the worst possible. Like, for example, vitamin D, the government tells you to take like 600 units or something stupid like that. Now, that was meant to prevent rickets. If you have 600, you will not get rickets. The vitamin C, like 200 milligrams, I don't think it's 200, it's like 72 milligrams or something stupid like that. Super low. You take that, you will not get scurvy. Really? You're not going to tell us the optimal levels? You're going to tell us the bare minimum that you need so that you don't get scurvy? I mean, isn't that messed up? Like, we know the higher doses of vitamin D are definitely beneficial for the immune system. Same thing with vitamin C, the antioxidants. We need them. So they never looked into it as what's optimal. Like, for example, vitamin D, everybody thinks like 20 or 30 is okay. But for mental health, recently psychiatrists are saying above 50. I like my patients to be over 65. Like, I myself keep myself at 100.
Yeah.
Because that helps me keep myself slim without working out. Sorry, I should. I wanted to. But somehow, since I figured out this hack, I just keep my vitamin D at 100 and my weight is stable as anything. Before, it used to fluctuate up and down, up and down. Like whenever I took the vitamin D regular, I would lose weight and then I would stop taking it or start gaining weight. Now, most people don't know this. So they go and spend thousands of dollars on Ozempic or whatever, If they would just understand this, but I'm not recommending that anybody takes high doses of vitamin D. I do. Because I've seen it help me. Because I used to be very deficient once upon a time. Like I broke 3 bones in my foot just walking. I was just walking and I broke 3 bones in my foot. That's really low. That's bad.
Yeah.
So I tried to get it as high as possible. So that's the vitamin D. And then, of course, omega-3 and iron. Those 3 things we definitely need to make sure that people get in, along with all the vitamins and minerals and protein.
Yeah.
And fat, you need fat for the fat-soluble vitamins, A, D, E, and K. But taking vitamin D with K2 is the smartest thing you can do. Iodine is another thing that most people are deficient. Because we live so far away from the oceans out here in Midland. Like you're at the coast, right? So you probably get enough iodine.
Yeah.
So, yeah, and here we're in Midland, like in the armpit of Texas, So we don't get enough iodine. So there's a particular vitamin D, D3, K2 kind of pill that has some iodine in it, C iodine. That's the one I recommend to my patients and I take it myself too. It has helped me reduce my synthroid dose from 150 to like 55 micrograms, which makes me, like I always knew that it was an iodine deficiency thing, but I couldn't prove it. But now that I'm seeing my dose come down so much, now I'm certain. And, like 50% of women above 40 in this country have thyroid problems.
Right.
So almost everything, like not everything, but almost everything is connected to nutritional deficiency. We talked about selenium yesterday, right?
Yep.
And it makes the glutathione recyclable. So selenium is amazing too. You take it on a regular basis, 200 micrograms.
Is there a list you can send me so I can put it in the show notes of the specific sort of combinations or supplements that you recommend if they don't have to be prescribed and they're just publicly available that I can put in the show notes?
The best thing I would say is to read that book, The Rare Earths Forbidden Cures.
Oh, yeah, that's right. Say that again.
So I'll show you the book. This is what it looks like.
Rare Earths Forbidden Cures for everyone listening.
And this is the doctor and his wife. Yep. So
I love good books.
You will not be able to put it down, man. I couldn't put it down. It's amazing. All the stuff in there is amazing. And this is just one of his books. He's written a whole lot. He's done like 10, 12,000 autopsies.
Oh, wow.
Because he was a pathologist for animals, veterinary pathologist. And then he became a naturopathic doctor and he did a bunch of autopsies and he figured out that, the muscular dystrophy is caused by selenium deficiency. And then that the pulmonary condition, that everybody thinks is genetic. It's called what's the word of it?
You'll think of it whenever you stop thinking about it.
No, I was telling myself I need to take my Deflin and forgot to take it. Sorry. What I noticed when I take the Deflin, I can remember things from 30 years ago, like in 1 second. It just pops into my head, like some guy, he was in my 4th grade class or something. I can figure out his name, like just like that pops into my head. When I take the Deflin regular. When I don't, this is what happens. I kind of like run into a brick wall. I'm like, and it's right on the tip of my tongue now.
Right.
Like,
while you're trying to remember that, just because I'm going to forget to ask, is there a way that people is there reliable at-home genetic testing or does it need to be implemented by a practitioner like yourself?
There used to be a company, I think they're going bankrupt. It's called like 23andMe or something like that.
Oh, they got sold. They're in a they're being depositioned by the Senate at the moment.
Oh,
Yeah, they did go
okay.
bankrupt. Yeah.
Yeah, that's
Someone
so
bought them.
sad. But I mean, Nebula Genetics, I think there's another company that does the entire home human gene testing.
But is it as
Like,
so? Is
they
it the
might not.
exact same thing that like you would do with your
It's not. It's
patients?
way more thorough. It's way more thorough, and that makes it way more complicated. Like you have to literally
Oh, I see.
sit down and study it and research it and figure it out because very few people really know how to read them.
Yeah.
Like I just know like those 16, 18 genes that we test for because I've had experience with them.
Yep.
But there are like thousands of genes, you know,
Right.
and they all transcribe different things. So the better you know, the more you study it, the more you know. I'm sure there are geneticists who are like totally interested in this and they understand everything because they've studied it and got PhDs in it and everything. But I don't run into those people commonly. Like I'm self-taught. I have to read it all myself and figure out what to do. So when I did the genetics, I would read up the mutation, then I would try to find a solution for the mutation. So the MTHFR is like the Deplin, and then for the DRD2 is the tyrosine, or COMT is all of those that I talked about: magnesium, SAMe, tryptophan, GABA. Then there's L-theanine. There's taurine too. Taurine also helps calm your nerves down. I've tried it. It kind of puts me in a very chill sort of state of mind,
I'm going to need a list for all this because people are going to ask and it needs to be in the description. I've been writing frantically, but there's so much information.
So I told you about that person. I had a guy, he was a bodybuilder. So he comes in and he's suicidal. I'm like, what? How much protein do you have? Like 215 grams or something crazy like that. So I'm confused. I'm like, wait a minute, 215 grams of protein? Then how are you depressed and suicidal? It doesn't make any sense. So we started researching that. It turns out that tryptophan is the precursor of serotonin, right?
Yeah.
But tryptophan crosses the blood-brain barrier, as do other amino acids too. But there are 5 amino acids that compete with tryptophan and they win. That's like tyrosine, phenylalanine, valine, leucine, isoleucine, these 5.
The branch chains.
So these amino acids, these people that make bodybuilder
protein. So those are the BCAAs, those are the bodybuilding blends.
That's what they take. So then that creates a situation where you have low tryptophan in the brain, so you end up with low serotonin in your brain, which can make you suicidal. There you go. So we figured that out, and I told him, okay, you know what? In the morning, start with the whey protein that has lots of tryptophan, and then you feel better. Then you start taking these other branch chain amino acids to build your muscles.
So separate them so they don't compete.
Yes, so that you start your day off feeling good. So you're not freaking suicidal first thing in the morning. Because if you deprive your brain of tryptophan for days in a row, you will definitely get that way. But this is the first time I had somebody who was taking so much of those amino acids that it was preventing the tryptophan from crossing the blood-brain barrier.
Oh, I had no idea. That is such a common thing. BCAAs are well marketed, all of those that you listed.
Yeah, and they probably work.
For muscle building.
Nobody sits and thinks that it competes with the tryptophan and creates like low serotonin levels in the brain and makes a person get depressed.
Oh, wow. Okay.
It's rare. The only time I saw this was that one time. It was a young kid, like 20 years old or 19 years old, working out, trying to be a bodybuilder. Nothing wrong with that. It's just that when you don't balance it out, when you only focus on the body, then the brain suffers. You got to make sure you do right by the brain also. Like, I don't remember if his vitamin D and all that was okay. It probably was because he was very aware of his body, so he's probably taking all the nutrients. I forgot his name, but I remember his face very clearly.
Interesting.
Anyway, so that's something I thought I should mention to you too.
Yeah, that's very useful.
It's only certain things that pop in my head, like when the topic comes up, then I think of something that, I had a patient that did this and how it presents. It's interesting though.
Okay, so to review for everyone, as we're running up on time here, we have basically fundamental nutrition for mental health. So we got magnesium, protein, iodine, so all the plenty of amino
Vitamin D.
acids,
Yeah.
some protein. So it's nothing like screaming, alarming, out of left field. It's just mostly fundamental nutrition and like basic lifestyle.
Common sense stuff. Like most, I mean, you know it because you've done nutrition, you understand it. But majority of average people, they have no clue. They don't even know how much protein they take every day.
Well, I didn't know that it was that. I thought it was a more complex, and I'm sure it's complex, but I didn't know that just, magnesium had that effect or caffeine had that effect on adrenaline. Like most people, myself included, don't. We know the feeling that things generate, but not sort of the large balancing act that it's blunting, like how caffeine actually works.
So that affects patients that show up in my office.
Yeah.
See, the average person, they don't have any of the anxiety mutations. They're not in a messed up relationship.
Right.
They're not, nobody's creating external pressure on their brains on a daily basis. Then they're able to consume the caffeine and live their lives and do okay.
Right.
It's just that there's so many of them that do not have symptoms bad enough to go to a psychiatrist or go to a doctor, but they're just suffering this nagging pain and, like insomnia, some high blood pressure, all of it worsened by caffeine. But they don't realize that. Yeah. And it's addictive, so they don't even want to listen to me when I talk about stopping it.
Right. I believe you.
They would rather take a pill, rather swallow a pill rather than stop the caffeine. And it's like, how can you keep drinking something that is like I tell them,
get addicted to that state of adrenaline. Like I've even had this where it doesn't feel like you're operating normally. Like without the life gets filtered through the parameter of how much adrenaline do I have. Like, or I'm just addicted to that level of cortisol and stress and adrenaline. And whenever it disappears, life just kind of takes a little notch down, which is actually, what it's supposed to be, but it feels totally different.
It feels worse because you've gotten used to a high level of catecholamines, in your brain. So you think that's normal, but that's not normal. That's you overthinking everything you do. See, any decision made out of fear is not the smartest decision. You know that.
Right.
And what happens when you drink caffeine? So like, if somebody's an insurance salesperson, he used to give free coffee to everybody because people buy insurance. And if their anxiety is triggered, they'll buy more insurance than they need, right?
That's hilarious.
But if you're trying to sell expensive cars, you want to give candy, you want to give cake, you want to give sugars. The sugars will stop the production of adrenaline. The minute you consume carbs, adrenaline production stops. So then you're like, oh yeah, I can afford a slightly more expensive car, because your anxiety is not triggered. But if they serve caffeine in a luxury car dealership, their sales are going to tank, man. I mean, because everybody starts freaking out about the anxiety caused by the caffeine. He's going to make them think that, oh, I need to be careful. Like what if something happens, I can't afford to make the payment. So they will try to get a car cheaper than what they can afford.
Oh.
Like these are just things that cross my mind sometimes. And I'm like, wow,
this is fascinating.
Like most people who are in business, they don't know these things. Like it would be great to sit down with somebody and actually try the strategy and do some research on it and publish it. Like, hey, so this particular dealership, they started serving caffeine and their sales dropped. And then they started serving cake and candy and all kinds of sweet stuff. And the sales went up. Theoretically, that should work the way I'm thinking about it. But anyways, so when my patients don't have, like they're having a panic attack or something and they don't have anything, I'll tell them eat some sweets. Normally, I tell them stay away from sweets. But if you're literally in the middle of a panic attack and you don't have any pills, nothing, you can't do nothing about it, have some sweets. Now, of course, brown paper bag, rebreathing your carbon dioxide would definitely help. It's when you lose all that carbon dioxide. See, carbon dioxide mixes with water and becomes H2CO3. It's carbonic acid, which is acidic. So when you hyperventilate, you lose all that carbon dioxide. So the H2CO3 becomes CO2 and H2O. So relatively, you go into a little bit of an alkaline state. When your blood is more alkaline, you tend to trigger all these anxiety centers in the brain. You start having panic attacks. I've seen, like, it's almost given, like anybody with anxiety starts hyperventilating, they're trying to trigger a panic attack without realizing it. And it does happen.
Interesting.
So
I appreciate all your insight.
they'll smoke a cigarette. I'm like, why are you putting carbon monoxide in yours? Just hold your breath to rebreathe the carbon dioxide. What you've done is by hyperventilating, you've created low carbon dioxide in your body. So that's making you crave a cigarette, which is freaking toxic. It's bad. But some of them get it, some of them don't. Oh, it helps my anxiety. Well, it helps your anxiety because it raises the carbon dioxide level in the blood, which increases the carbonic acid. And that's the reason why you get more acidic. I like take vitamin C. Well, have some, squeeze a lemon into water and drink that.
Some other acid. Yeah.
Or do some jumping jacks. You make some lactic acid in your body, and that will help make your blood acidic, and you won't be anxious anymore. That's really true. If you do jumping jacks, your panic attack will go away.
I used to sprint whenever I had panic attacks for my college years, so my early 20s. And if I felt one coming on and I was just spiraling, the only way I could break myself out of it, because you can't think your way out of it, you can't calm yourself down. I would literally just sprint out of my house and just sprint for about 20 seconds. Gone. Yeah.
Isn't that amazing?
Yeah.
You figured it out somehow, but.
Well, it was the only thing that would help, just rapid movement.
Right. Yeah, I had one patient, whenever he got anxious, what he would do is he would take that, you get the squeezed lemon, like there's a bottle with lemon juice in it. He would just drink that lemon juice. His stepfather was a dentist, so he would get mad at him because he's like, that lemon juice is destroying destroying your teeth. So, but he's like, that's the only thing that would help his anxiety. So
rapid acidification. That's good to know. Yeah. I didn't know about the blood alkalinity. How far, because blood's usually what, 7.3, some 7.35?
7.35.
How far does it have to go for that to trigger?
I don't know the exact numbers, but I know for sure that, if somebody already has anxiety and they're hyperventilating, when you're more alkaline, I remember I used to do EEGs in the psychiatric department in India, and they would have people hyperventilate. Then they would have flashing lights to see if they can trigger some kind of, activity in the brain that is more seizure-like. So these things trigger seizures, like hyperventilating for no reason. That lowers the seizure threshold.
Oh, wow.
So if that person is prone to having seizures, then that EEG will show it. Now, you ever heard of electroencephalogram, right? But there's a magnetoencephalogram, which doesn't even touch your head, but it can record your brain waves. Now, that tells you that thoughts are energy, and you can actually transmit your thoughts. For real. I'm not making this up.
Magnetic waves, yes.
Yeah. And you know what absorbs all the thoughts? Black. When you're wearing black, you absorb everybody's freaking thoughts. So I try to wear white as much as possible. I work with psychiatric patients. So I don't want to absorb all of their thoughts. I want to reflect them. So I'm trying to reflect all their thoughts away. So white reflects everything, all types of energy, like light.
Yeah.
Light is energy.
Yes.
If thoughts are energy, then wearing white would protect you from bad thoughts. So that's why when you go to funerals in India, everybody's in full white. Because when you go to a funeral, people are having all kinds of negative thoughts like sadness and, But here, everybody's wearing black. They all like to get miserable together, I guess.
That's fascinating. I didn't know it. I mean, I knew the effects of light reflecting off colors, but I guess I didn't piecemeal it. And I did know that thoughts created
energy.
Energy, but I hadn't put that it was the same concept together, that you could actually reflect the same wave.
Yeah. See, when you forget something, like for example, I'll tell you, I bet you must have done this. You go into a room and you're like, why did I come here?
Yeah. Oh, yeah.
What do you do? What do you do? You walk back to the same spot where you were when you thought about what you wanted. And the minute you walk to that spot, immediately it comes into your head what you were looking for, because those thoughts are still freaking hanging in the air over there. So when you walk there, you perceive those thoughts and now your memory comes back.
That is how I do that. That's odd. Yeah.
Everybody does it that way, but nobody thinks about it. So why did I have to walk back to the exact same spot where I thought about what I wanted? And how come a foot away from that, I couldn't think about what it was? But the minute I went back exactly to the same spot where I was standing, it immediately comes into my head. And that makes me wonder if thought energy kind of lingers in the area, wherever you're at. So imagine that. We are moving around. In a funeral, you're moving around, right?
Yeah.
People with all kinds of negative thoughts. Nobody's sitting in there thinking of happiness. Everybody's freaking crying and thinking of negative things and sadness and everything.
Yeah, lots of grief.
And they're just like, absorbing each other's negative thoughts. Everybody's come here. Everybody comes to make me miserable. Like that's the way I look at it. So I make sure I wear white all the time, as much as possible, at least,
That has definitely changed my perception of color. So I'm going to try that out. Yeah.
Oh, yeah, especially if it's a disturbing thing or if you're getting in a situation where people are going to be upset or mad or sad. You don't want to take all their negative energy. You want to absorb it, but you don't wear black at all.
Interesting. Okay. This conversation was so much more than I had hoped for. I really appreciate all this information. This was wonderful.
Sure. I mean, please fact check me. Fact check me.
I'm sure people will run it through AI. I don't have to do it. People will run everything through AI and just believe it, whether they want it or not. But I mean, no one's fact checking the thoughts and magnet. Joe Dispenza is one of the only people who I've heard lecture on the magnetic and the electromagnetic nature of thoughts and emotions.
Yeah, and he's right about it. It's real.
Yeah,
he's not making anything up.
No, I mean he's measuring it too. This is new to people who think through a pure chemistry lens, but for anyone who's remotely aware of energy, this is going to become very, very common in probably 5 years or sooner, hopefully. But if someone wants to learn about everything you said, can they find you online, or are you just a physical practice?
I'm just in practice. Like I don't post anything online, and all my patients want me to have a podcast and all that, and I'm like, no, I don't want to get into that, because once I get into it, then I'll be like too focused on that, and I won't do what I do. Like I don't.
It's definitely a part-time job. It can be a part-time job. Yeah.
Oh yes, but it occupies you. See, even though
it does.
It does occupy your brain and your thoughts and your time. Like when you're sitting around, like you're just trying to fall asleep, you're like ideas,
Oh, you don't have to tell me. Yeah, that's exactly what happens.
Yes. So I know how obsessed it can make you kind of obsessed with it.
Well, I will not be able to until this is out and published. I won't not be thinking about it. It'll dominate my thoughts until it's done.
Definitely.
So exactly.
Definitely. Yeah. And so when you're trying to, and whatever you're doing, you want to be successful at it. You don't want to have a bad podcast. You want to have a good one. So I don't blame you,
Yeah.
It's interesting. Anyway, anything else?
No, I think if there's anything you'd like to leave the audience with, we covered a ton. Anything you want to drive home?
We covered a lot of things here.
We did.
But there's always a reason for whatever you're feeling, whatever you're going through. There's always a reason. That doesn't mean that you have to make drastic changes. You just have to become aware of things. Sometimes just naming the emotion helps the emotion get better. Like for example, you find yourself getting frustrated and you're like yelling at everybody around you. And you just become aware of, I'm getting frustrated. And you have to say it like, I'm getting frustrated. I need to take a deep breath and calm down. Just saying that, identifying the emotion with a word helps. Because most of the time when we're acting weird or we're just creating stress for other people and spreading our misery, we don't realize it. But the minute you catch yourself and you can name the emotion, great. In fact, even other people, if you see people who are upset and mad, if you can just help them label that feeling that they're having, you can usually ask them questions to make them. So people who have autism are very poor at that. They cannot name the emotion. Like, it's funny. I'll ask them, how's your mood? And they say things like neutral, average. Like, that tells me nothing. Neutral is like a beer in the car, like, what are you talking about? Neutral mood? That doesn't make any sense. The question was very specific. Describe your mood. And you're telling me it's average? What do I know? What is your average? I don't know. Please elaborate. Like, use some other words, and they have a tough time, very tough time. So one of the things like when I evaluate Asperger's or autism patient, I will ask them, if they come across totally normal, then I'll ask them questions like this and see if they can name the emotions well. Because if you can't name your own emotions well, how are you going to show any kind of understanding of another person's emotions? Your social skills are definitely going to be limited. Sure. Anyway, I could keep going on and on for like hours.
Well, we might need to do a part 2. I appreciate your time, Dr. Shams.
Thank you. It was fun talking to you.
Likewise. fundamental nutrition is so important. I didn't realize how important it was for our mental health prior to this episode. If you're at all curious about the different easy options Dr. Shams listed, obviously run it by your healthcare practitioner before you start mega dosing anything. But a lot of the things we mentioned, like omega-3 or anything like that, is pretty benign. Obviously, if you have a mental health diagnostic or diagnosis, check with your professional first. But I'll put everything he listed corresponding to the different mutations in the show notes. And Dr. Shams and I did meet through water. Midland's water is pretty awful, as is a lot of people's around the country. So if you're just trying to get clean water and eliminate that anxiety from